name is Jackie Saps, and I've been coming to Goldson Spine now for 3 to 4 years.
Miss Saab, who I think has great energy, she's staying very, very active in her retirement. Thank God for making it her retirement. She goes to the gym. How often do you go to the gym, Miss Saab?
At least 5 times a week.
5 times a week. What are you doing when you go to the gym?
I use all of the exercise equipment. I start with the upper parts of my body and then the lower part. I do the leg press. I work on my upper shoulders. I walk on the treadmill and use all the equipment I can get in.
So basically, she's a lady that is going to stay active, and because of that, I think she's in great shape. And for that reason, she's one of my favorite, not just because of her personality, but because she's so consistent with her actions, you know, with her level of activity. Even when I walked in, and even now she has pain right now. What you been doing since before I walked in the room?
Before you walked in, I was walking around this room doing push-ups against the wall and walking around and dancing by myself.
Right.
And I also walked this whole walkway all the way to the other end and back while I was waiting to get in here.
Now, I don't expect everybody to be as active as Miss Saab is. However, there is a benefit to consistent activity, because if you stop moving, you start getting stiff. So a lot of patients I have, either they're in retirement or they're getting ready for retirement. I almost ask every patient who's been working for almost more than 15 years how long they continue to plan on working, because there's preparation for retirement. And I'm not talking about financially and spiritually or emotionally. I'm talking about physically. And if you start getting to a standpoint of just being active now, when you do go into retirement, it's going to be easier. You can't sit around the house and do nothing.
Exactly.
Because you're going to get stiff, you're going to have more pain, and you're going to get weaker. That's just what the body's going to do. The law is we go from order to disorder. We don't go from disorder to order without putting in energy. So Ms. Saab constantly puts in energy. So that's the spill on that. But however, this morning she walked in and she had a lot more pain on her left hip than she has had in the past. Typically it's been her right hip, but today is her left hip. And it's a common condition that I want to talk about. It's actually a pelvis issue. It's called SI joint dysfunction. SI joint dysfunction. Sacroiliac joint dysfunction. Right? A lot of times people walk in and they think it's low back pain, but it's really not low back pain, it's pelvis pain. And that's what we're going to talk about this morning. Alright, Miss Saab, come on up.
I had driven here from another state, Missouri, and it took me some days to get here all by myself, and I was in such pain after driving so long, I had to find a doctor that could help me. That was Goldson Spine.
When we're talking about low back, we're really considering these 5 bones right here. That's called our lumbar spine. 5, 4, 3, 2, 1. So most of the time when patients walk in, they're saying, I have low back pain. But at least 40% of the time, they're dealing with what's below the low back, below the lumbar spine, which is our pelvis. The pelvis is made of 3 bones. Left ilium, sacrum, and the right ilium. Let's just call it the hip. I don't like calling this the hip, but it's better to call it the hip. It's easier to understand, but truly this bone and socket is the hip. But for purposes of this, we'll call this hip pelvis. So in Ms. Saab's case, in many people's case, while it's not low back, it's where this hip comes into the tailbone right here. This is called the SI joint. Again, sacroiliac joint for short. And it's a joint that is very different than all other joints in the body. Most of the joints in the body are fit almost like a lock and key. I'm going to rest this, okay? Fit almost like a lock and key, just like this. The SI joint is very different. It's I call it a gnarly joint that fits more like this. And so it's easy for it to go click out of place. And when it does click out of place, it doesn't have to be much motion, it just has to be that. And that level of motion or misalignment will cause pressure across this SI joint. So if you notice that you're having pain to the low back area around the pelvis, more on one side than the other, it's probably SI joint dysfunction. I'm going to move this. And it's good to note that, because even with Ms. Saab, this is where our SI joint is. Ms. Saab, how's that right there?
Pain.
Pain. Right in here. Pain. Because this is the SI joint. And that's a problematic joint, because once that pelvis goes off, click, it creates inflammation here. That inflammation then, if it goes untreated after 1 day, 2 days, 3 days, can become very severe. Side note, if you have SI joint dysfunction or SI joint problems, it's usually going to be the same side all the time. Can it move? Yes, but typically that's going to be the weak link in the chain. And when it goes off, and it can go off by taking out the garbage, it can go off by doing an improper move, sitting down for too long, obviously trauma. It's one of those things that, a lot of things that can impact it. But once it does set off, there's a series of events where the inflammation starts to spread up the spine. Now, Masad woke up this morning, so it hasn't really taken impact or affected the muscles on that same side, but typically it'll go all the way up, and a lot of times it'll go down. So what we're going to do is a couple of treatments for this. I personally like to do manual therapy on it first, because a lot of the inflammation is coming from the ligaments that have become aggravated. It's almost like a sprained ankle. You know how you roll an ankle and there's a lot of pain in the ankle?
Yes.
Yeah, and it's not so much the bone, it's the ligaments that holds that joint together that's painful. So first thing is, I like to try to get some manual therapy into the joint. Take a break. Tell me if you have any pain down here inside.
I mean, I feel it.
Is tender there?
Yes.
Alright, so this is extended down. We'll check the other side just to make sure. You still have it on the right side too?
Yes.
Okay, alright. So I don't want to go straight into the adjustment without stretching out the joint, without preparing the joint, and loosening up the tissue. I'm coming down here a little bit. Take a break. So right now we're treating it, but the cause, like I said, can be a lot of different reasons, but usually unless it's trauma related, it suggests some type of imbalance. Even if we're talking about muscle imbalance. There's a muscle deep in the buttocks, it's called the piriformis, which goes right up to that SI joint, and if that's tight, it can pull on the joint until the joint gets pulled out of place. So right now we're working on the piriformis muscle. We're working on the actual SI joint, and then we'll be adjusting it to put it back into the proper alignment.
I feel that right there. That's the
Yeah.
inside. Yeah.
That's right now is that muscle. That's the piriformis muscle.
Right. Okay. At this age, I'm 73 years old, and Dr. Goldson has done a lot to help me keep my body in shape, keep my spine working, and this is the most wonderful place you could go to because it's like family oriented once you come in.
As the table is going down, it's creating a flexion at the hips and the low back, and it's distracting at the spine. So, open this up a little bit. So with the flexion distraction, you're gonna feel a little bit of stretch. How you doing?
Good.
Okay. Okay. So the goal right now is to get that pelvis and the ligaments around the pelvis stretched out. I can adjust the speed. There you go. This is actually one of my favorite techniques. So when you think about chiropractic care, a lot of people just think about the movement of the bones. And there's a lot of different ways to move bones. But I went to Parker Chiropractic College, which is in Dallas, Texas. And they teach 7 different techniques. And one of the very first techniques that they teach us is called flexion distraction. Now mind you, when I went into chiropractic school, I was already a physical therapist. So I had a superiority complex thinking that I already knew everything that there was need to know about healing the body. But there was a lot that I had to find out, and flexion distraction was one of them. Why I like it, it focuses on tight muscles of the low back, and it's one of the best and most effective ways of stretching those muscles while distracting the spine and taking pressure off the disc. How you doing, Masad?
Fine.
Tell me if the pressure's too much, because I'll ease up a little bit, okay?
No, I'm good.
You alright?
Mm-hmm. Yes.
Right there, right? So what I'm really focusing on is on the SI joint, putting a little pressure as the table's going down. I'll let you explain it. What are you feeling as we're doing this treatment?
Actually, feel like the pain may be rising, going away just a little bit.
Mm-hmm. And the reason that could be is because it's not just about the joint being out of place, which we talked about. We know we have piriformis issues, but it also creates tightness in the low back muscles. So there's three things that muscles do. Muscles contract, they stretch, and they conduct electrical signal. So to effectively rehab a muscle, and most conditions come around, like even SI joint dysfunction, it's not just all joint being out of place, there's a muscle component as well. Once we get that muscle to stretch, which is what we're doing right now, and in a minute you're going to see how we're going to get it to conduct electrical signal. We may not get it to contract today, but because Miss Saab does that naturally all the time anyway. That'll start easing out the muscle and causing reduced tension on the pelvis. Right now, with this stretch is a quad stretch, using the flexion distraction. I'm getting a stretch across the front of the hip. How we feeling, Saab?
Okay.
All right. So after we do this stretch with the flexion distraction, we're going to do ultrasound. Most people are familiar with the diagnostic form of ultrasound.
So we're doing combination therapy, which includes ultrasound and stimulation, electrical stimulation, and that gets pretty much deep within the muscles to help it relax and all that stuff. I find this therapy rather effective because immediately you can feel a difference.
Ultrasound that we're actually going to use is the ultrasound that produces sound waves that are therapeutic. So with that, it helps those sound waves help to penetrate to an area, increase deep heat to the area, and flush the area out of metabolites, which is, so just think about metabolites as this. You have an injury. What happens with that injury? There's a process that goes through inflammation. There's a process that goes through rebuilding. So the body, in essence, is actually having to rebuild a job site. So a lot of times if you're not hydrated or you're not getting proper treatment, inflammation sticks around. We are at the next junction. So treating SI joint dysfunction, because we see a lot of it. Come a little closer, please. So we see a lot of it. We basically got way that we like to treat it. We saw the stretch. You saw the ultrasound combo. Now it's time to adjust the pelvis. Ultimately, the pain is coming because the pelvis is out of place. We do all the other things before we get to this point to settle down the ligaments, settle down the muscles, and settle down some of the inflammation around that area. But ultimately, we still got to move the bone back in place. So, Miss Saab, I want you to make a wish. Yep. There it is. Good job. Good job. Other side. Good job. So while it was pelvis on that left side, it's more like low back on that right side. Relax this right here. I got you, man. I got you. Relax that. All you gotta do is relax. Let it go. So I'm thinking about the pelvis, where I'm rocking, and there it is. Lay flat on your back for me, please. The right side wasn't nearly as restricted as the left side. Lay flat on your back. Pet peeve of mine, always wash your hands before you go to anybody's neck.
Thank you.
You're welcome. Good thoughts. Happy thoughts. Relax yourself. Relax. 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 Good job. Relax. Let it go. Let it go. Let it go. Good. Let it go. Relax yourself. Beautiful. Don't move. Just stay still. Just relax. Turn this way a little bit. Alright. Relax yourself. Relax yourself. Relax yourself. Tuck your chin down. There she is. There she is. Wait, hold on. Hold on. Hold on. Hold on. One more time. There it is. That's a little stuff. Lay back. Stay down. Stay down. We've done all the active components. She's pretty active. The pelvis was definitely out of place. Remember, this is for treatment for SI joint dysfunction, sacroiliac joint dysfunction. If you want more information on it, how you can do it is how it usually is caused by some awkward movement, sitting down, taking out the garbage. There's so many different ways of doing it. However, the symptoms usually feel the same. It's usually on one side more than the other. It feels like low back pain, but it's more pelvis than it is low back. If you allow it to stick around for longer than 2 days, it's going to get worse. Because unless we put the pelvis back into place, it's going to be more inflammation around the joints, which is going to affect the muscles and more so affect the ligaments, and you're going to have a hard time to walk. And the worst case about it is, because it's the pelvis, anytime you put pressure or weight on that side, it increases the pain. So 9 times out of 10, you start standing like this if your pain is on the right side, or you basically start putting more pressure on one side, which affects the other side and affects the balance of your pelvis. So you're not fixing the situation, you're making the situation worse by trying to avoid the pain. So more with SI joint dysfunction, do not wait. Chiropractically is very effective in treating SI joint dysfunction. It may take more than one treatment, of course, because we're talking about inflammation, we're talking about a human body that's trying to heal itself. However, starting the healing process with putting the pelvis back in the right position is the best thing that you possibly can do. Because you can find yourself taking Advil, Aleve, and all these over-the-counter pain medications because of the pain, when really the problem is your pelvis is out of alignment. Where we're going to finish off with is some electrical stimulation.
It's Jacqueline. Today I am putting the electrical stem on you to help you with your muscles. And then I'm going to put an ice pack because your pain scale is very high. So it should help with the inflammation, okay?
Okay.
And some ice to settle down the inflammation and the spasms in the area. And we're going to call that for a day. We're going to see Miss Saab later on in the week to see how she's doing and to continue treatment. But this is treatment for SI, sacroiliac joint dysfunction. Don't live with the pain, treat the pain. All good.
I highly recommend Dr. Goldson and Goldson Spine Center to everyone. If you have aches and pains, need any help with your body, this is the place to come. This is a family-oriented place that makes you really comfortable, makes you feel well welcome, and makes you feel real good by the time you get your treatments here.